Henry is just a ball of energy. He's the sweetest kid you'll ever meet. He likes being on the swim team, and he plays guitar. He loves all things music. He has a harmonica he plays around with.
Henry is adorable. That's one of the first things I remember about meeting him. He first came into my clinic when he was 4, and he came in because he was already followed by the Neurofibromatosis Center because he has a family history of NF1.
Henry's diagnosis is Neurofibromatosis 1, which is a genetic disorder that presents with growths or tumors.
So Neurofibromatosis Type 1 is a pediatric brain tumor predisposition syndrome. Kids with NF1 have about a 15 to 20% chance of developing an optic pathway glioma. And although these tumors are low grade, they can result in significant neurologic problems, including blindness.
We actually knew there was a 50% chance he would have it because his older sister has neurofibromatosis. Ironically, my husband was diagnosed in the same appointment.
It is a tremendously variable disease. Even among family members, you can see quite a wide variety in symptoms where, one person might have learning difficulties and an optic pathway glioma, and the next person has a bunch of dermal neurofibromas, so kind of what looks like moles all through the skin.
His particular diagnosis is he has an optic glioma, which has been inhibiting his vision. His sister, really doesn't seem to be affecting her all that much. She really hasn't had any side effects other than maybe some minor muscle weakness.
We talked to family about different treatment options and ultimately decided to start a biologically targeted agent that's targeted towards some of the pathways that are abnormal, and that drug is a MEK inhibitor.
Can you hold your arms out like this?
She was just so kind and caring. She made us feel really comfortable with putting our child on a chemotherapy drug.
That has actually been quite successful for him. He hasn't had a lot of toxicity, and his vision improved on the course of treatment. And we ultimately got to the point where it was successful enough that we wanted to see if we could wean him totally off the drug. After that, we'll really have to watch for rebound growth of the tumor on MRI and then rebound vision loss.
He just phased off at the end of June. As long as he has this genetic condition, he's going to be having MRIs fairly regularly. At Children's Hospital, everyone has done everything they can and done exactly what they needed to do in every step of the process that really prevented him from having complete vision loss. I can't imagine what we would do without doctors being able to really research and develop these drugs and alternative uses for them, because his drug, selumetinib, was used for body tumors, not for brain tumors. The other option would be to have a port in his chest. And can you imagine being 4 years old with a port in your chest? My main wish for Henry is to just grow up without a care in the world, to just know that he is just like everybody else, and just because he has a few minor medical setbacks doesn't mean he can't achieve everything he wants to achieve.
Thank you so much for your generosity. We're all very grateful for the people that are willing to open their hearts and open their wallets and really recognize how important it is to fund research into pediatric cancer so that ultimately we're able to design better therapies for kids that come in with tumors.
Without those donations, there are children, not just my children, who wouldn't have access to care that could play a huge role in their entire life and in their future health. And for Henry, it's been so great providing those services that have really made him the cheerful, happy kid he is, despite everything he's had to go through. And I really think those kind of services we've provided made him continually like the happy, healthy kid he is.